This is Boomer Life on CL 650.
Welcome to Boomer Life on CL 650. In studio today, Dr. Chris Coburn, the medical director of the SmartShape Weight Loss Center. We've been talking today about the comprehensive weight loss management programs like the lap band, the gastric sleeve, the gastric balloon to a lesser extent. But one of the things that I found important and you wanted to touch on again was the body mass index, the amount of recovery time. A lot of people have questions about that because they don't want to be tied up forever and a day once they get these procedures.
Right, Judge. So we would certainly encourage people who have questions, obviously come to our website, call us at smartshape.ca. But body mass index, again, we talked about this earlier, but probably worth repeating. Body mass index is a measure, if you want, of the level of obesity. We tend to, with the heavier patients, maybe suggest a gastric sleeve procedure because the risk-benefit ratio is more in favor there. Lap band, we use it, I've done patients who weigh 500 and 600 pounds with a lap band. So these procedures are applicable to all patients. And everyone has to be treated as an individual, and we talk to them and discuss with them which one may work best. One of the questions we often get is how long will it be before I'm back to normal? I want to stress that both the lap band and the sleeve are laparoscopic procedures, so there's no big incisions. We just look inside with a little telescope and either implant the band around the top of the stomach or remove that part of the stomach that we do with the sleeve. The lap band procedure takes about 30 to 45 minutes. The gastric sleeve procedure probably about 60 to 90 minutes to do. With the lap band procedure, you're home the same day. Yeah, you leave the clinic about an hour and a half later, and most of our patients would be back to their normal level of activities within about 3 to 4 days. With the gastric sleeve, we keep people in the hospital for 2 days for observation. They can then get home, but most people with the sleeve are still back to work within about 10 to 12 days. So these aren't operations that lay you up for a long period of time. There's not a lot of pain with them, again, because there's no big incisions. But it's the beginning of a new way of eating, a new way of feeling not hungry with small portions, and something that allows people as they lose weight to obviously improve their health, improve their energy level, start to become back to the person that they want to be.
Now, you talked about, I think, one of the most important things that it's not like a hair club advertisement where they say, looking good is the most important part of feeling good. Feeling good means that you are able to do more things, to get out and be part of your workplace, have fun, with your family.
Yeah. So, and that comes back to the question of how do we define success? We don't define or look at success by how many pounds somebody loses, but in fact, very early in the discussion, we want to know why do they want to lose weight. So for some people, it's they want to be able to roll around on the floor and play with their children. They want to ride a bike. They want to walk up a flight of stairs without being short of breath. Women may want to shop in a normal-sized clothing store, do their own toenails. I mean, there are many different ways that people define success with weight loss, but the important thing is to figure out why is your weight a problem for you, and let us at SmartShape try and work on a solution that's going to work for you.
You've had some very interesting success stories. You're telling me about a gentleman on the East Coast.
Yeah. So again, the radio show reminds me of a fellow we have who works in the radio business on the East Coast, who's done extremely well, and in fact has written a book that we give our patients when they come see us called Fat Man Walking. Very interesting book, very inspirational story. I was in Regina yesterday operating, and we had one of our patients came to a support group that we ran there. A fellow who, when we did his surgery, his lap band procedure was 530 pounds, and he's now down to 260 pounds.
Wow.
And you cannot imagine how that changes somebody's life. I mean, 260 pounds, he's still a big guy, but his health, his mental health, his physical health has improved dramatically. And we at SmartShape, we have story after story after story of people like that. In fact, we have a whole group of people we call our ambassadors, individuals who've had success with our various weight loss programs at SmartShape, and they are more than eager to talk to potential patients and tell them about how they've achieved their success and what that has meant for them.
And this is not just for people who are older. These are for younger people, too, who have been able to go on and do things with others in their age category, play football,
Sure.
things like that.
You know, a favorite story is a young girl who came to see us and was having trouble getting pregnant. She was, I don't know, 25 or 30 years old. Let's say she weighed 300 pounds. She had a lap band procedure, got her weight down to the low 200s, and then was able to get pregnant. And in fact, got pregnant with twins. Delivered 9 months later, delivered 2 healthy twins. And what was most interesting is she lost another 30 pounds while she was pregnant, and yet delivered healthy twins. So it's stories like that that are incredibly inspirational for us at SmartShape, but stories that we want to share with patients who want to hear about it. Just go back to a little bit about the lap band for a second. Is one of the advantages for young women with the lap band, this adjustability means that if someone gets pregnant and needs to eat more during their pregnancy, we have the ability to take fluid out of the band during the pregnancy, allow them to eat more during the pregnancy, and then at the end of the pregnancy, tighten it back up again. And this is what we did with this girl, and that's how she lost her weight and had healthy twins.
And I think it's important to point out, as you've explained to me, that the largest number of your clients are female, and this is not just appealing to something about vanity. It's the difference in the physical makeup of a woman versus a man.
Sure. So when, as we said earlier, men tend to carry their weight more centrally, and it's more risky to their health. Women carry their weight more peripherally on their hips and buttocks and abdominal wall. It's less risky to their health. But from a social point of view, being overweight is much more of an issue for women than in men. And subsequently, 80% of our patients are women.
Let's talk about why your procedures. What about your team? What makes you stand out? What makes you, tell me why I want to go to your offices or make that call or check your website.
Right. Well, SmartShape, first of all, experience. Our team has had experience with well over 5,000 procedures, whether they be lap bands or gastric sleeves or balloons over the past 12 years. We have an incredibly dedicated and talented team of healthcare professionals who will help our patients as part of the programs that we offer. We make all the choices we make are geared towards what gives the best outcome. For example, the band that we use is one of only 2 bands that's approved by the FDA for use in the United States. There are other bands that are available here in Canada that don't meet the FDA guidelines. They're not good enough for us at SmartShape. So we only use the best techniques, the best devices, the best anything we can, because we want our patients to be successful. That's where when our patients are doing well, then we're doing well.
We talked a little bit about a growing acceptance among medical doctors, general practitioners, and working with their patients who have weight issues, obesity, and so on. I would think that people who are working in the diabetic field must be embracing what you're doing.
Yeah, so we're working very closely actually with the Canadian Diabetes Association, trying to find ways to potentially make the funding of these procedures more accessible to those with diabetes. The lap band device that I've talked about was approved by Health Canada in 2009 as a treatment option for type 2 diabetes, meaning just like there are medications on the market such as metformin, liraglutide, and a bunch of others that are used to treat type 2 diabetes, so is the lap band considered by Health Canada a treatment option for type 2 diabetes because of its dramatic 75% of patients who have a lap band and are type 2 diabetic will no longer be diabetic, i.e. not need treatment within a year.
And when we say this, I mean, you always have diabetes, but if you control it to the point that you don't need medication, boy, is that the answer? Because I believe statistics have said that once you start even on metformin, a type 2 diabetic, within 10 to 15 years, you could be on insulin if you can't improve those sugars. So this must be a huge option.
Yeah, so we really want to talk to diabetics early in their course. They need to try again the diets and try the non-surgical methods. But if we can get the type 2 diabetic before they've gone to requiring insulin, then again we get that 75% chance of putting their diabetes into remission.
So we've talked about the other scourge of the current time, diabetes. Obesity has covered so many, has now been linked to so many things. Depression is even a link there. Talk a bit about that, what you found.
Yeah, well, again, it's, we see over and over the number 80%. So 80% of individuals who suffer from depression, especially if there's a link between their weight and the depression, will get to the point where their depression is measurably improved, significantly improved, maybe to the point where they can get off their medications as well. Depression is a little more complicated, a little more sophisticated than it is with something like diabetes. But yes, there's significant improvements in many different aspects of health. As I said, we talked about diabetes, the hypertension, the high cholesterol, sleep apnea, joint problems, lots of them.
I would think sleep apnea, anything that, your eyes might be closed, you might think that you were asleep at night, but if you can't sleep, I mean, that exacerbates your other problems too.
Well, certainly there's a link between sleep apnea and hypertension. I spoke last night to a group of family physicians about just that issue, about the links between sleep apnea and obesity and diabetes and how they're all really interrelated.
When we come back, we'll talk about that personal commitment that you have to make once you've talked to the people like Dr. Coburn, what you can do and what you must say to yourself and how it can make such a difference in your life when we are back with Boomer Life on CIL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650.